Here's a thought that might stop you in your tracks. Not every breast lump is harmless, especially as we get older. Finding a lump in your breast can be a frightening experience at any age, but it's a situation that deserves our calm, focused attention. This matters so much to us as seniors because the simple fact is, the risk of breast cancer increases significantly with age. Understanding what's happening in our bodies is the first step toward taking control of our health. It's about knowing when to be reassured, and more importantly, when to take action. The purpose of this video is to empower you with knowledge. We will help you understand the difference between common, harmless lumps and those that absolutely require immediate medical attention. We're going to give you the information you need to be a confident advocate for your own well-being. Understanding breast lumps, harmless versus concerning. First, let's talk about the types of lumps that are most common and, thankfully, benign or harmless. Many women, including middle-aged and older women, will experience cysts at some point. A cyst is simply a fluid-filled sac in the breast tissue. It might feel smooth and mobile, and it can sometimes fluctuate in size or tenderness with hormonal changes. Another frequent benign growth is a fibroadenoma. This is a solid, non-cancerous lump that often feels firm and rubbery, like a small marble. While these are common, they are not the only possibility. Now here is the crucial part. While most lumps are indeed benign, the chance of a lump being a malignancy or cancerous increases as we age. This is especially true for women after the age of 50, and the risk continues to climb in our 60s, 70s, and beyond. A new lump in a senior is taken more seriously for this very reason. This leads to the most important point of all. You cannot self-diagnose a breast lump. It is impossible to know for sure what a lump is just by feeling it. The importance of a medical evaluation cannot be overstated. Only a qualified healthcare provider can accurately diagnose the type of lump you have using professional exams and diagnostic tests. Why seniors need to pay special attention to breast lumps. As seniors, we need to be particularly vigilant about any new breast lumps. The primary reason is the clear link between age and breast cancer. The incidence of breast cancer rises significantly as we get older, which statistically makes any new lump found in a senior more concerning than one found in a younger woman. This isn't meant to cause fear, but to underscore the need for proactive care. Furthermore, our breasts themselves go through natural changes with aging. Over time, the glandular tissue in our breasts is often replaced by fatty tissue. This can cause the breasts to lose some of their earlier firmness and become softer. While this is a normal part of aging, these changes in breast tissue can sometimes make it more difficult to feel a new lump, or it can even mask or mimic the feeling of a lump. These factors create challenges in detection. Because our breasts feel different than they did when we were younger, and because the risk is higher, our level of vigilance must also be higher. Paying special attention to any and all changes is absolutely critical for our long-term health. Signs that a breast lump might not be harmless. Characteristics of suspicious lumps. So, what are the specific warning signs that a lump needs to be checked out immediately? Let's start with its physical characteristics. A suspicious lump is often, but not always, hard, like a small rock or stone. It may have an irregular shape, meaning it doesn't feel like a smooth, round ball. Perhaps the most significant sign is if the lump feels immovable, as if it's anchored or fixed to the skin or the tissue deep inside the breast, rather than being easily moved around. Another key factor is its persistence. Benign lumps, like cysts, might sometimes fluctuate with hormonal changes, even for seniors who may still experience some hormonal effects from medications or natural processes. A concerning lump, however, does not get smaller or go away. Instead, it may stay the same size, or more worryingly, grow progressively larger over a few weeks or months. Any lump that does not disappear on its own needs a professional evaluation. Associated skin and nipple changes. A lump doesn't always appear by itself. Often, the surrounding skin and nipple will show telltale signs that something is wrong. Be on the lookout for any skin dimpling or puckering. This is a classic sign where the skin over the lump is pulled inward, sometimes resembling the peel of an orange. You should also pay close attention to any unexplained redness, swelling, or a feeling of heat, which are signs of inflammation on the breast skin. If this is persistent and not caused by an obvious infection or injury, it is a red flag. Also, watch for any new nipple changes. This could be a nipple that suddenly turns inward, a condition called inversion. It could also be a persistent rash, scaling, or itchiness on the nipple. Finally, any unusual nipple discharge is a major warning sign, particularly if it is bloody or spontaneous, meaning it happens without any squeezing. Lumps with pain or discomfort. It is a common myth that breast cancer is always painless. While it's true that many cancerous lumps do not cause pain, some do. Therefore, you should never ignore a lump just because it is tender or sore. A key warning sign is persistent breast or nipple pain that is localized to one spot and does not resolve. This is a pain that is not linked to a known injury or a skin infection. If you have a lump that is accompanied by pain or discomfort, it absolutely needs to be evaluated by a doctor. Think of the pain as an additional signal your body is sending that something needs attention. While the pain could be from a harmless cyst, you cannot take that chance. Any lump associated with pain warrants a prompt medical visit to determine the cause. Lumps with lymph node involvement. Sometimes the first sign of a problem isn't in the breast itself, but nearby. Be sure to check for any swelling or distinct lumps in your armpit or in the area around your collarbone. These areas are filled with lymph nodes. When breast cancer begins to spread, it often travels to these lymph nodes first, causing them to swell. Recognizing these signs is critically important because lymph node involvement can indicate that the cancer is no longer confined to the breast. Finding a swollen lymph node, either with or without a noticeable lump in the breast, is a significant warning sign that requires immediate medical investigation. It's an indicator of potential spread that your doctor needs to know about right away. Other warning signs. Finally, there are some more general systemic warning signs that can accompany a dangerous breast lump. These are clues that your whole body is being affected. Pay attention to any unexplained weight loss when you are not trying to lose weight. Another major sign is persistent and profound fatigue, a feeling of being completely drained of energy that rest doesn't fix. A general feeling of being unwell that you can't quite put your finger on can also be a related symptom. Also, be aware of any visible changes in the overall size or shape of one of your breasts that doesn't have an obvious cause. If one breast suddenly seems larger, lower, or shaped differently than the other, it's worth noting. When these general symptoms appear alongside a lump, they create a bigger picture that strongly suggests a need for an urgent medical checkup. What to do if you find a lump? If you find a lump or notice any of the other signs we've discussed, the very first step is simple. Do not panic. Take a deep breath. Remember that many, even most lumps turn out to be benign. However, that reassurance should not lead to inaction. The lump still requires a professional evaluation. The best way to notice changes early is to practice regular breast self-awareness. This means knowing what your breasts normally look and feel like, so you are more likely to detect something new. Once you find a lump or any other suspicious sign, the next step is non-negotiable. You must seek medical advice promptly. Call and schedule an appointment with your healthcare provider. When you see your doctor, they will perform a clinical breast exam. Based on their findings, they will likely recommend further diagnostic steps. This typically includes imaging tests like a mammogram or a breast ultrasound, which help visualize the lump. If these tests show anything concerning, a biopsy may be needed to get a definitive diagnosis. It is also vital to practice good follow-up. Do not ignore a lump that persists, even if it was initially deemed non-threatening. Overcoming barriers to care for seniors. We understand that taking this step can be hard. Many seniors face barriers to getting care. These can include feelings of embarrassment or denial. The fear of a potential diagnosis can also be paralyzing, making it feel easier to ignore the problem. We strongly encourage you to push past these fears, practice open communication with your family, and, most importantly, with your doctors. They are your partners in health. Remember the incredible benefits of early detection. When breast cancer is found early, treatment is often simpler and far more successful. You are giving yourself the best possible chance for a positive outcome. Conclusion and call to action. To summarize our key message today, not every lump is harmless, and as seniors, we must be vigilant. Knowing the signs of a concerning lump is one of the most powerful things you can do for your health. We hope you feel empowered to take your breast health seriously and to seek medical advice promptly for any changes. You are your own best advocate. If you found this information valuable, please share this video. Help other seniors in your life stay informed and proactive. And don't forget to subscribe to our channel for more essential health tips designed just for you. Thank you for watching.